Now to the Lakers, ending their regular season last night with a 131-107 win over the Utah Jazz. And now it's time to focus on the playoffs. But there's some concern since both Luka Doncic and Austin Reeves are out indefinitely due to their injuries. Both players are expected to return to the lineup, although we don't know exactly when. Luka is out with a left hamstring strain, and Austin is out with a left oblique strain. Joining us now to talk about those injuries is Dr. David Gazzaniga, orthopedic sports medicine surgeon and division chief of sports medicine at Hoag Orthopedic Institute in Irvine. Good morning, doctor.
Hey, good morning. How are you?
Good, good. Now, you've also served as team doctor for several professional teams, the Chargers, the New York Jets. So you're very familiar obviously with all these injuries. Let's start with Luka, though. He went overseas to get treatment. Can you explain what that hamstring strain is and, all of that?
So obviously hamstring strains are one of the most important injuries that occur, particularly in NFL players at the beginning of the season. It's the cause of most time lost. But in essence, when the muscle tears, you have to give it time to heal. And far beyond when it becomes comfortable, you have to be able to get up to where you can run full speed. And so it's if you're not careful on the return, then it could extend the time to return, which could be a detriment to seeing him in the playoffs.
Okay, so what's the recovery time for something like this? Do you think he could be back? Like, how long could this be?
So in general, when you look at an injury of a grade 2 in a hamstring, I typically would put that return to play at 4 to 6 weeks. It depends on what muscle it is, whether it involves certain aspects of the muscle, the fascia, closer to the tendon. So there are some nuances to it, but 4 to 6 weeks would be the general return to play on that.
Okay. Now, what do you advise your patients that might deal with something like this? What do you recommend they do while recovering from this type of injury?
My patients versus Luka might be different. Looking at the general public, there's a few days where you give it rest, then you start to work on some stretching, and then you start doing some eccentric load on the muscle. The muscle has an amazing capacity to heal. You just don't want it to heal too fast where it gets tight and you have re-injury, or you don't want to stress it too much where it doesn't have the ability to lay down the muscle fibers properly. So it takes a little bit of skill, but there is definitely a sweet spot, a window that you want to work in to move things along properly.
Okay, let's go over to Austin Reeves dealing with a left oblique strain. Can you first explain what that injury is exactly?
Well, when you do crunch sit-ups and, you look at people that have six-pack abs, the abs that are on the side are the obliques, but they're critical for core strength, and in particular change of directions. For basketball players, that would mean, being able to cut, run, pass, shoot. Almost every aspect of the game is going to be involved using the obliques.
Okay, so this is pretty serious, this injury. What's the recovery time then for a strain like this?
Well, I've seen it listed as a grade 2, so it's difficult to say. One thing about an oblique strain is that there's pain definitely, but it's the kind of pain, the muscles are a little bit smaller, and you could play through the pain a little bit better. You could wear a binder, and sometimes that can make it feel more comfortable. And it doesn't get loaded quite as fast as a hamstring, so you might look at that as like a 2 to 4 week type of injury, depending on where it is and how it's responding.
Okay, so Austin Reeves would be coming back probably before Doncic.
I would guess that he would. That's obviously not looking at the MRIs and not knowing what magic potion that Doncic had in Europe.
I know, that's another thing of him going all the way to Spain for this, but hey,
I could give you a lot of information about that, but it would overflow this whole interview.
Okay, segment 2 tomorrow. Dr. David Gazzaniga, thank you so much for joining us this morning.
All right, thank you.
All right.